And tonight, the CDC is making a major change to its quarantine rules. The switch comes amid a spike in coronavirus cases here in California and nationwide. The state's test positivity rate has risen to 5.4%. That's a 2.8% jump in just the last week. Tonight, KPIX's Betty Yu speaks with medical experts about the surge and the CDC's announcement.
Doctors say the Omicron surge hasn't yet hit the Bay Area. And tonight, the CDC shortened the recommended time for isolation after getting COVID from 10 days to 5, as long as people don't have symptoms.
So I think there are good things and bad things from going from 10 to 5 days of isolation. In general, it's a good thing because we can get our workforce ready as fast as possible. The second thing is you have to be wearing that mask for the remaining 5 days, and not just any mask, a really good mask.
Those who are exposed to COVID but boosted will no longer need to quarantine. UCSF's Dr. Peter Chin-Hong added that based on early data from Europe, about half of Omicron cases are asymptomatic.
Well, it's spreading really fast. I think that when you look at San Francisco, you get a sense of what it looks like to be a very, very well vaccinated city that's still being careful. A lot of masks out there, and yet the number of cases in the city has gone from about 40 a day to about 350 a day just in the last couple of weeks.
UCSF Department of Medicine Chair Dr. Bob Wachter says the reassuring part is that hospitalizations have increased only by 5%.
The variant is itself a little bit milder, but probably more importantly, when the variant hits a lot of vaccinated people, a lot of them are going to get infected, but not that many are going to get super sick.
Across the country, children are filling emergency rooms. Pediatric hospitalizations are now at their highest levels since September. Among patients between 5 to 11, none had been vaccinated. As people make difficult choices about get-togethers and New Year's plans this week, Dr. Chin-Hong says even he's changed his mind about indoor dining.
Last week, if you'd asked me, I probably would have felt more comfortable. This week, I'm a little bit more queasy, and I probably would feel most comfortable dining outdoors. It depends on the situation, but I'm lucid, I'm relatively healthy.
In San Francisco, Betty Yu, KPIX 5.